So we had a very wonderful meeting. We learned a lot of things with so much interesting lectures, bubbles everywhere. What do you think of it? What is your impression of the meeting?
Oh, no, it was an excellent meeting. The progress being made in the field is tremendous. Now, it may be since it's been at least a 2-year delay, and so the amount of new information over the last 2 years is quite dramatic. But no, I'm very impressed that people are making a great deal of progress, especially in the basic sciences and in the therapeutic. As one who's not an expert in these areas, I was very impressed with the likely clinical value these may have when they get developed. And some of them are at the stage of where they're doing clinical studies. The thrombolysis of the coronary arteries in particular, they were delayed by the COVID, which is a shame, but they're now ramping up again, and that could have a huge impact if successful.
Okay, and what do you think for next year? What should we add more to this meeting so that it be more wide to everyone?
Well, I think that some of the things that we've seen already, more clinical studies so that they're ready to be applied at the bedside would have a great impact. And I think it's also just it's important for the people to understand some of the techniques involved in doing it. Now, nothing in echocardiography in particular is simple, and so they're all a challenge, but the potential reward is worth the challenge, and that's got to be conveyed. If things could be automated, that would make it easier. The other is cardiology in particular. They like to measure things. I've said in the past, it's an exaggeration of course, but radiologists rarely measure anything, and cardiologists measure everything to 10 decimal places. We're obsessed with numbers. And so some of the efforts that I heard today were to try to quantify some of the observations that we're seeing, and that is a good move. Quantification, sometimes you can measure and make interpretations that your eyeball may not. And we certainly see that in just routine echocardiography, and I'm sure that's true with contrast as well.